Hello, I'm Sarah Scott, Director of Public Health for Gloucestershire. No doubt you would have heard a lot about testing for Covid-19. I thought it would be helpful to tell you a little bit about what's happened so far, what is currently happening and what the plans are for the future. Covid-19 was first detected in Gloucestershire back in February. Public Health England was carrying out a programme of testing and tracing. This means exactly what it says. When anyone displayed symptoms of Covid-19, they were tested, and if they tested positive, they had to isolate for 7 days. In addition, PHE colleagues would ask that person for the details of where they had been and who they'd met, so these people could be traced and alerted to the fact they would need to isolate for 14 days to allow time for any symptoms, if they had Covid-19, to be displayed. PHE colleagues would then keep in touch or trace everyone to monitor their progress and offer advice and support. However, in March, when the spread of the virus began to increase in the general population nationally, testing and tracing stopped and became focused on those within NHS services, both staff and patients. This was because it was important to know if a patient had the virus and so they could get the appropriate treatment. For NHS staff, as they were at higher risk than the general population of both being exposed to or passing the virus on to vulnerable patients, they were also tested if they had symptoms. It meant staff who had symptoms but didn't actually have Covid-19 could continue working if they felt well enough to do so, or that if a member of their household had symptoms, they could be tested to check whether the worker needed to continue to isolate with them. Since the start of April, it's been possible for more people to request a test. In Brockworth, there is a testing site run by local NHS colleagues to test frontline health and social care workers or members of their households. As not all the tests have been needed every day, NHS colleagues agreed to pilot a programme which would make them available to care home residents and staff who are possibly suffering with Covid-19. For care home staff, in the same way as with other key workers, knowing whether or not they actually had Covid-19 meant they can either isolate if they were testing positive to minimise onward infection, or carry on working if they tested negative and felt well enough to do so. And helping to minimise infection within our care home residents is clearly essential. Swabbing kits are delivered to care homes by fire and rescue colleagues who show staff how to carry out the swabbing correctly. This local offer is in addition to the National Care Home Testing Portal, which was launched on the 11th of May, through which care homes can apply for test kits for all staff and residents with or without symptoms. This was initially prioritised for those homes caring for older people or those with dementia. Around 30,000 tests a day have been made available nationally through this programme. From the 7th of May, we've also benefited from having a mobile testing facility in the county, based here at Oxford's Tennis Centre in Gloucester and run by colleagues from the military. The site provides testing for those who meet the broader set of criteria set out by the government. Nearly 3,100 tests have been carried out so far. We hope to have confirmation of a fixed testing site in the county very soon, which would be able to offer up to 700 tests a day. Increasing our local testing capacity is a really important part of managing the spread of Covid-19. As of the 18th of May, if you have a fever or a new continuous cough or a loss of change in sense of smell or taste, and you are aged over 5 years old, you can request a test. You can register for that test on the NHS website after checking your symptoms. If you don't have access to the internet, you can call 119 to book a test. If you are an essential worker or a member of an essential workers household who has symptoms, you should continue to register for a test through either the self-referral and employer portals on the government's website. If you are eligible, you need to get the test done the first 5 days of having symptoms. It's best to apply for the test in the first 3 days, as it can take a day or two to arrange. There is a temporary testing facility at Oxford's Tennis Centre in Gloucester, which is now with us till the end of May. There are also 2 regional testing centres in Bristol and Worcester. And as I mentioned earlier, we are confident we will soon be allocated a fixed testing centre in the county, which will be able to do 700 tests a day. If you book a test, please make sure you turn up for it, otherwise someone else who needs one may not be able to. You could also ask for a test kit to be posted to you if you're not able to get to one of the testing sites. At Oxford's, you will be given all you need when you turn up. You will need to take a swab of the inside of your nose and the back of your throat using a long cotton bud. These are then sent off for testing. You will need to do the same if you're carrying out the test at home. The test is checking to see if you currently have Covid-19 virus and if you need to self-isolate. It is not for healthy people to show if they've ever had Covid-19. The government aims to return results to you within 48 hours of the swab being taken at a testing centre, or with 72 hours for a home test. Go to the NHS website to check if you meet the criteria. If you do, follow the instruction for booking a test. If you have severe symptoms, please call NHS 111 for advice.